Fenbendazole is a low-cost medicine used to treat worms in animals. People can buy it at animal supply stores, online, or from chemical companies. It was first patented by a big company, but now anyone can make it. Some folks with cancer have started using fenbendazole, or FBZ for short, to try and fight their disease. Research in labs shows fenbendazole, or FBZ, can fight cancer in many ways. I would like to use cancer-preventing vegetables, cruciferous vegetables including broccoli, cauliflower, Brussels sprouts, leafy greens, carrots, and allium vegetables, that is, garlic, onions, are associated with lower cancer risk due to their antioxidants, vitamins, fiber, and other protective compounds. While no single food can prevent cancer, a diet rich in a wide variety of these vegetables, along with other plant-based foods, helps reduce risk. It helps stop cancer cells from growing. It also makes cancer cells stop dividing and even die. FBZ can hurt cancer by stopping new blood vessels from forming in a tumor. It can lower how much sugar and glutamine cancer cells can use. But most of these findings come from research with cells in the lab or tests on animals. There is not enough research in real people yet. This report talks about 3 people with advanced cancer who used fenbendazole, or FBZ, while taking other treatments. But they didn't use chemotherapy. 2 people had their cancer go away completely. 1 person saw their cancer almost disappear. All 3 tolerated FBZ well and did not report bad side effects. Let's talk about their stories. The first person was an 83-year-old woman. She was told she had breast cancer in 2009. She got surgery and medicines. The cancer came back in 2021 as stage 4 and spread to her bones, liver, and lungs. She decided not to get more common treatments like chemo, so she started using FBZ. She took 222 milligrams every day. She also started another medicine to block hormones. She got a short pulse of radiation for pain in her spine. She kept taking FBZ for 8 months. While taking FBZ, her cancer markers in blood dropped from over 300 down to the normal range, which is below 40. Her liver numbers got better. A scan in April 2022 showed no signs of cancer. By June 2022, the doctors said there was no active cancer found. Even after stopping FBZ, her tests stayed normal. In July 2022, her liver numbers went up, but doctors could not be sure if it was from FBZ, the other medicines, or the mix. Liver numbers went back to normal soon after. She stayed cancer-free and kept taking FBZ every day for almost 3 years after doctors said she was in remission. The second person was a 75-year-old man. He had prostate cancer that returned with spread to many bones and lymph nodes. His main cancer sign in blood, called PSA, started going up again. He began hormone treatment, took bone support medicine, and used many supplements like vitamin D, magnesium, melatonin, curcumin, artemisinin, and others. He started taking FBZ, between 222 and 444 milligrams every day, or often. After 1 year, his bone cancer shrank, and cancer in his lymph nodes was gone. After 2 years, even more bone cancer was gone, and nothing new showed up. The main blood test for prostate cancer stayed below 0.05 for over 2 years. The man had no rise in liver numbers and did not report any side effects from FBZ. He stayed on FBZ along with routine hormone therapy and did well for over 26 months since the start of FBZ. The third person was a 63-year-old man with an advanced type of skin cancer called melanoma. He had surgery and other cancer medicines, which worked for a while. The cancer came back in 2023, showing up in his belly, bones, and other places. He also had another kind of cancer in his urinary tract. The doctors planned to start him on an immune medicine soon, but he started FBZ during a break in treatment, taking about 222 to 444 milligrams every day. He also took his usual vitamins and supplements. A special blood test for melanoma was very high at the start, over 123. In just under 2 months after starting FBZ, his cancer marker dropped to less than 1, and then 0 after about 9 weeks. During this time, he only got 2 doses of the planned immune medicine. At the next doctor visit, the scan and blood tests showed no sign of cancer. He stayed free of cancer for over 11 months after starting FBZ. A table in the report makes it easy to see the details. Cases, cancer type, treatments, FBZ dose, outcome, how long followed. Stage 4, breast, FBZ, hormone, supplements, radiation, 222 mg/day, complete remission, 3 years. Stage 4, prostate, FBZ, hormone, supplements, 222, 444 mg/day, near complete remission, 26 months. Advanced melanoma, FBZ, surgery, supplements, 222 mg/day, complete remission, 11 months. FBZ is in the same family as some other old worm medicines used for people. It stops cancer by breaking down the support structure inside cells, making cancer cells die. FBZ also turns on a key body protein called p53 that helps control cell health. It messes with the way cancer cells use energy. FBZ might help attack special cancer stem cells that can make cancer come back. Researchers have seen these effects in labs before. But we do not know how much FBZ matters in these 3 real people. The limits of this report are important. It is only 3 cases. People decided on their own to try FBZ after saying no to standard treatment or after seeing reports online. We do not know each person's full story. All 3 people also took many other medicines or supplements, so it is hard to say which thing worked. The doctors only watched what happened. They did not plan a controlled experiment. Anyone trying non-approved medicines like FBZ without a doctor is taking risks. There are problems with self-dosing, not knowing if the medicine is safe or what the real dose might be. These stories cannot prove that FBZ alone made the difference. Some more details are worth mentioning. In the first case, the woman saw her cancer go away during the same 8 months she took FBZ. She kept taking FBZ after the cancer was gone. But she also took other medicines, so we cannot say for sure what made the biggest impact. In the second case, FBZ use lined up with steady drops in the cancer blood test, and pictures showed shrinking cancer over 2 years. The man reported no side effects, even with the higher dose. In the third case, a quick drop in the melanoma blood marker matches the time the man started taking FBZ and before he started the new immune medicine. But he still got surgery and other treatments close to the same time. Researchers are interested in drug repurposing, which means using old medicines for new jobs. FBZ is cheap and easy to get. If it is confirmed to be safe and helpful in larger studies, it might become an extra tool for cancer care, either by itself or with other treatments. But right now, these stories are not enough to say everyone should use FBZ for cancer. More research with bigger groups, planned ahead and closely watched by doctors, is needed to prove it is safe and that it works. Until then, people should talk to their doctors and not use medicines like FBZ on their own. To recap, research in labs found that fenbendazole works against cancer cells in several ways. It can stop the cell cycle, make cancer cells die, and block cancer cell growth. But real-life proof is scarce. This small report shares 3 stories of people who saw their cancer shrink or disappear while taking FBZ, along with other treatments, without noticeable side effects. The good news is, these cases hint that FBZ could help, but until there is better research, it should not be used outside of a doctor's care. Reliable research is needed to understand how well FBZ works for cancer, what dose is safest, and for which types of cancer it may work best. This is not medical advice. Always talk to your doctor or medical professional before. Thanks for watching. Please click the like button and share with your friends. Do not forget to subscribe. See you in the next video.